I'm Patrick Davis, a general and bariatric surgeon here with the surgical clinic. I am a native Tennessean. I grew up in Chattanooga. My wife is here from Brentwood, and so this is a great opportunity for us to finally return home. I did my undergraduate medical school work at the University of Tennessee, and then I went to Wake Forest University Baptist Health for both my surgery residency and a minimally invasive and bariatric fellowship. One of the things that I think really drew me towards doing a fellowship in minimally invasive and bariatric surgery was the potential to embrace new technologies as they come out. In my fellowship, I did a lot of advanced laparoscopy, which is surgery through a lot of small incisions, which in turn brings with it a lot of decreased postoperative pain, faster recoveries, quicker return to normal activities. But it also allowed me to venture into the field of robotics, and we are able to perform a lot of surgeries robotically that laparoscopically were quite a challenge. One of the things that I love the most about bariatric surgery is seeing those end results. Having that patient come back and see me 6 months, 12 months later, who's now run a 5K for the first time, who can now get up and get out and go for a walk when before they were always limited by the things that held them down. And they have a new lease on life and they are truly happy with themselves. And that to me is more rewarding than anything that I could ever imagine. I also offer the full breadth of general surgery. I operate on anything from hernias to gallbladders. I do emergency surgery like appendix removals, bowel blockages, perforations. We also offer services in terms of excision of small lesions, things we call lumps and bumps, lipomas, things that can be done here in the clinic. Which is one of the big reasons why I love general surgery. It allows me to offer many different services for these patients, and it allows me to fix a tangible problem. One of the things that I really take pride in is my approach in treating my patients the way that I would want my family members to be treated. Not only in the treatment, but how I describe issues, how we describe surgeries. I would want a surgeon that could talk in a language that I could understand. And I pride myself in walking a patient through whatever they're about to go through in terms that they can understand so that they can mentally wrap their mind around it. I want all my patients to know my thought processes so that they can then have an idea of what to expect. So I'm a fellow of the American College of Surgeons. I'm also a member of the Society of American Gastrointestinal and Endoscopic Surgeons. And from a bariatric standpoint, I'm a proud member of the American Society for Metabolic and Bariatric Surgery, which is our overseeing body. When the opportunity arose to become a part of the surgical clinic, it was a professional opportunity for me that I simply could not turn down. Being a part of such a great group of surgeons that prides themselves on great patient outcomes and safe and effective patient care, to be a part of that is very much in line with what my goals are for treating my patients. It is good to be back home in Tennessee. I've always had an affinity for all things sports Tennessee. I'm a Tennessee graduate. I love the Preds, I love the Titans. We have two beautiful kids, my son James and my daughter Amelia. We love to get out and play in the yard. I love to get out and play golf when I can, but the most important thing to me is time with my family.